What do you think, Anjali?
I think that I wanted to touch a little bit about the fact that women that have medical cards can't use their medical cards to access abortion, to pay for their abortions. And so if this is their right, how are they how are they accessing this right if they can't afford it? That's another issue. I think that the Hyde Amendment needs to be repealed. Period. The Hyde Amendment needs to be repealed. And before I even knew anything about the Chicago Abortion Fund, it was just a big gray area of how to pay for this abortion, which can become stressful and the situation is prolonged. I think that the Chicago Abortion Fund, there needs to be more funds, such as the Chicago Abortion Fund, because with the Hyde Amendment in place, these women need to be able to have an outlet that they can come to and seek financial assistance without being stressed because of the finances, or without having to carry the pregnancy to term if that's not what they want to do. Everyone knows their specific situation and what they can handle. So,
and one of my favorite quotes that I like is, if you can't trust me with choice, how can you trust me with a child? And I think that really sums up a lot about, how we feel and what we support. I think we have a question, Anjali.
yes, we have a caller.
Go ahead, caller.
Hi. In terms of the funding, I just had a conversation with my mother, and I was telling her that I'm all for choice, but, I shouldn't have to pay. And she told me, well, if you're a senator or something like that and you have health insurance and you decide you want to get an abortion, who do you think pays for that senator's health insurance as a member of Congress or something like that? That is the government. So in essence, you are paying. So I just wanted to say something like that. It's all about deserving versus undeserving in terms of people, what they think who should get an abortion or whatever. And then I also had a question about, you said something about needs to be repealed, and I want you to give more information about that.
Okay.
What's that?
Okay, well, we will address that. We're talking about the Hyde Amendment. The Hyde Amendment was enacted in 1975, which means that poor women that are on Medicaid cannot pay for their abortions with their medical card. Before 1975, they could. And why this is extremely important now is because women that are on public assistance prolong getting their abortion because they cannot afford it. And so they are having abortions later. And if they had the opportunity to get them quickly with their medical card, then you would not have women coming into their second trimesters seeking abortion services. I think a lot of that would be reduced. So that's what the Hyde Amendment is. This is something that on a grassroots level throughout the country, we're trying to get this repealed and do what we can to turn this back, because it is unjust, it is unfair. Poor women deserve the right to full reproductive health care, and a piece of that is abortion services, but they deserve respect. They deserve birth control that's good for their bodies. They deserve the same things that people that have private health care deserve and have. And just because they're poor and they're on Medicaid does not mean that they should not have those things. In terms of the comment about not wanting to pay for it, we hear that a lot. A lot of people say that, but if a woman carries a pregnancy to term and has a child that she does not want, and she's on public assistance, you are still paying for it. So, it is a catch-22. you are going to pay for it. We all pay. We all pay for it. I work every day, and I pay for things that necessarily I don't want to pay for. I don't want to pay a water bottle tax. I mean, this is a part of living in society. Some things we pay for that we don't want to pay for. But poor women deserve respect, and they deserve the things that we have, and that is full reproductive health care. What do you think, Anjali?
I think that the point that you made about the fact that you're going to pay regardless is very important. If a woman has a medical card and she's seeking an abortion and can't pay for it, she brings the pregnancy to term and she's on medical assistance, then she's feeding her child through the government and things of this nature. So it becomes the issue of grant the accessibility, grant the choice, grant the right, because there's no room for judgment. Anyway it goes, you're going to come out of your pocket. So I want to be clear, I don't think that the caller is passing judgment. I'm saying that in this reproductive movement, there is no room for judgment. It just isn't. And another reason why I'm here and my face is on television is because a lot of women died trying to seek abortions. A lot of women that came before us that were involved in this movement, they had so many obstacles, and we still face obstacles in this movement, but before the obstacles were greater. Abortion was legal. Women that seek abortion had to go through underground railroad, so to speak, type places to get abortions, and it's just not safe, not healthy. And we have women who have the gift to reproduce should just period make their own choices and decisions. I don't see where a man fits into that anywhere.
I think we have a question, Anjali.
Yes, we have a caller. Go ahead, caller.
Hi. I'm actually calling because I agree with you. I also believe that the Hyde Amendment is unjust and unfair, and it should be abolished. And I was wondering if is there any hope of that?
Well, that's what we're working towards, caller. There's a movement. We presented, I believe, over 20,000 signatures to Washington in January in time for the Roe v. Wade anniversary. And so we are working on that state by state. We are working to try to repeal that. It's a process. Things don't happen overnight. But one of the biggest things is, and like what Anjali said, she's here and she's having her face here and I'm having my face here, is because more women need to come out and speak out about it. We need to be a powerful force working towards this. It cannot just be men, politicians, people working against women's rights. If we come out and we talk about it, and we are not ashamed to talk about it because we don't feel abortion is a dirty word, then we make the movement stronger and we make our position stronger. And so we're going to continue to keep talking out about it. We're going to continue to keep pushing our agenda and working our very best to get this repealed. And this means that we have to bring more women to the table. And like I said, all the women in our leadership group are women that we've given funding to. And so we're bringing them back to the table and letting their voices be heard about this, because these are things, their voices are ignored. Politicians don't hear their voices. And we want to stand up and shout and say, this is unfair. And we deserve the right to control our fertility and our reproductive health. And so that's where we stand on that issue. Thank you for addressing that, caller.